Thank you for joining us for today's Level Up webinar. My name is Dawn Lane, and I am the Program Manager for the Massey Learning Institute. October is Breast Cancer Awareness Month, and today we have a special presentation for you. Our session is entitled Breast Cancer, a Survivor's Story. And with us today, we have Dr. Asante LeBlanc, and I know you know her very well, whose passion include helping to guide individuals on their road to optimum health. So in her practice, she integrates complementary traditional medicine with conventional Western medicine. So after losing her grandmother to cancer, she decided to do something more for persons affected by this terrible disease. So she began working with the Trinidad and Tobago Cancer Society, where she is currently the chairwoman of this TNT, a long-standing NGO. Also today, we have Miss Claudette Stewart. I call her a warrior, a survivor, and she will share her story of being a cancer survivor with you. As always, we invite you to post your questions in the question and answer box. And as we have two presenters today, let's post them early so we can get through as many as we can. Remember, if you like or want to ask a question that someone has posted, please click the thumbs up icon by that question, and this will further help us in selecting questions which we really want you to hear and that you are keen to have answered. So I don't want to waste any time today because we have so much to share. It is now my pleasure to introduce you to Dr. Asante LeBlanc. Doctor?
Morning. Thanks, Dawn. Morning, everyone. Claudette, good to see you. Good to be here and be invited. So, October Breast Cancer Awareness. I'm so thrilled that Massey MLI decided to do a different slant on things, which is showing survivorship. Breast cancer is, and this is, the statistics, it is the leading cancer in women worldwide, regionally, and locally in Trinidad and Tobago. So I say that because I don't want us to think that it's something that we're doing wrong in the Caribbean and we're not noticing that this is worldwide. Every 14 seconds, a woman is diagnosed with breast cancer in the world. Just let that sink in. And while we speak of breast cancer, we don't only include women, we also have men, but it's just that women are much more affected. So how are we going to make a change? How are we going to say we want to be like Claudette and survive? And Claudette is a unique survivor. And when she tells you her story, Claudette is one of the survivors in our group that leaves us all flabbergasted. But, she is a warrior, as are all our survivors. Cancer does not equate death. I think that's important to get. A diagnosis of cancer does not equate death. That's number one. Number two, why is screening for breast cancer so important? If you screen for breast cancer, and that is, we're looking for a disease in a so-called normal population, and if you do your proper screening, then we will detect the cancer much earlier. Early detection, along with healthy lifestyles, continued screening, that is your weapon, that is your arsenal to surviving cancer, to having a greater chance of beating that disease and looking cancer in the face and saying, not today. Yeah? I want everyone to remember lifestyle. And we've spoken about this time and time again, a healthy, balanced diet. And this is going to go on, and y'all going to ask tons of questions. Don't stress. Just be calm and think healthy, balanced, and local. Just think of those words and we get a good diet. Our exercise regime. It don't mean you're doing something you don't like. Find something you like because it's your lifestyle. Yeah, very important. Don't smoke. Don't vape. There are no ifs, ands, and buts about it. It's not like I'm taking a smoke while I drink a beer. No, don't smoke and don't vape. decrease the amount of alcohol, so not an excessive amount of alcohol intake. And ladies and gentlemen, know your family history, because knowing your family history gives you an edge when it comes to screening and speaking to your physician. And I'll tell you why in a minute. How do we screen? From a very young age, we can start to teach our young girls to do their self-breast examinations on a monthly basis. 5 days after their period ends, they start to examine their breasts. We've done a self-breast examination before, and we can show you that again if you need it. Then every year, a clinical breast examination with a doctor or a registered nurse. And then comes the mammogram and or ultrasound. Everybody's fearful of a mammogram. They say, oh God, it's two metal plates, it can squeeze me. No, it's uncomfortable, but it doesn't have to pain. You do it 5 days after your period is ended. And this is a simple exam, 15 minutes, that can save your life. And we do mammograms every year. When do we start a mammogram? We start a mammogram between the ages of 35 to 40 in general. Stick a pin, because if you are younger and you have a strong family history of an aggressive type of breast cancer, then your physician, you have to speak to your doctor. And as you speak to your doctor, they will then decide when you start your baseline mammogram, and it can be earlier than 35. I say this to you because this is how we empower. Education is a great, great tool to surviving this horrific disease. And I want you to also not stress, because not every lump you feel is going to be cancer. So don't be panicking and don't get Googleitis. Go to your doctor if you feel a lump and get it checked out. I am not going to sit here and tell you that you could eat healthy, exercise like a beast, do everything Dr. LeBlanc say, get your screening and you won't get cancer. I am not going to tell you that. I am not going to tell you that you could do your mammogram this year and it's normal and next year you get an abnormal mammogram. I'm not going to tell you that. What I'm telling you is, this is your fighting chance. This is your weapon to save your life. So you can't live in fear of the diagnosis. We're giving you the opportunity to save your life and be proactive, to truly be that warrior against this disease until we can find a cure. Yeah? So don't be thinking, well, I hear about this one who do a mammogram here and then she turned up with a lump. It's all possible. We have seen so much unpredictability in life in the last 2.5 years. It's all possible. But guess what? At this time, our gold standard, our best tool is what I just explained to you. And those ladies who have very small breasts, who think it can't fit in the mammogram paddle, two things. We have smaller paddles. And if you really don't want a mammogram, we will do an ultrasound. But if the ultrasound comes back positive, we're going to have to do that mammogram. Go with a girlfriend. Just do it. Just get screened, educate yourself, and be empowered. And do not be afraid of that diagnosis. But most importantly, screening for early detection is what will save your life. And I want to hand you over to Claudette. Claudette is an amazing, amazing survivor. Claudette is one of these that I say she eats something different because her story is so different to others in our group. But you know what? One thing remains the same with all our survivors: the fight, the willingness to live, the mindset that you were telling cancer after you get that diagnosis, what you tell cancer as you go through that journey. Don't let a diagnosis define you as a patient. Yeah? So I hand you over to Claudette. I thank you, thank you, thank you. I'll be in the background. Claudette, my girl, rocking my lipstick. All the best.
Hi, good morning again, everyone. I am Claudette Stewart. I am 53 years of age. I am married with 2 beautiful daughters and 1 handsome stepson. I am a hairdresser by profession. I was diagnosed. I'm also a 10-year breast cancer survivor. Sorry. I was diagnosed with breast cancer at the age of 43. My journey started in 2011. I was concerned about a cyst in my left breast. So I decided to go to the doctor to have it checked out. He examined my breast and we did an ultrasound and he told me there isn't anything to worry about. I could come back and visit him again in 3 months. I did visit him in 3 months and he examined it again and he told me there isn't anything wrong with it, leave it alone. I went back again in 3 months' time. He told me we'll do another ultrasound. So we did another ultrasound, but we did the ultrasound on the both breasts this time. When we did the ultrasound on the both breasts, we realized my right breast also has a lump. I was concerned about the left breast. He told me he would try injecting the lump in the breast to see if he would get any fluid or anything like that that he could send for testing. He didn't get anything when he did that. And he told me, he said, you know what? I will give you the same advice that I will give to my daughter. He said, leave that alone. It's just a cyst and the size of it. No doctor not going to cut that. Nobody not going to do anything with that. Leave it alone. Nothing is wrong with it. I went home with that on my mind because you know sometimes your body does speak. Our body does speak to us physically. And I knew something was wrong. I didn't sleep properly that night. It was on my mind and I saying, you know, something is wrong with my breast. I know this is not right. I decide next 2 days I went back to our medical center. I said I will go to the nurses station this time because if I ask to see another doctor like that, I would not get to see another doctor like that. So just like that. So I decided to go to the nurses station and ask for a pap smear done. Now, bear in mind, I wasn't due for a pap smear because when the nurse asked me, she said, Claudette, you due for a pap smear? I fib and I said yes. I know why I wanted that pap smear because normally in the woman's clinic, you get a breast examination done and a female doctor will carry on that female clinic, that woman's clinic. So I know I will get a different doctor. When I got the appointment for the pap smear, I went. It wasn't too long after. From the time my doctor started examining my breast, as she felt it, her first words was, Claudette, what is this? And I said to her, but you is the doctor, you tell me. She said, how long you have that day? I said, well, there a while now. And she said, any doctor saw it, they examined it. I said, yes, and we do ultrasound, and they told me it's just a cyst and it's innocent, to leave it alone and don't worry about it. She said, get up and change your clothes. I get up and I put on my clothes. Well, from the time she said that, I knew something was wrong. So I asked her what happened. She said, that is not a normal lump that I am feeling. Something isn't right there. That is not normal. Now, she just feeling this and could tell me that. She gave me 2 letters. She said, I want you to go up to Augusta Salon and I want you to do, I don't want you to do one or the other. I want you to do the both of them one time. I want you to do an ultrasound and I want you to do a mammogram. She said, as soon as I get the results, I want you to come back to me with these results. I went and I had ultrasound and the mammogram done. Normally, you know, when you do a test, they will tell you to come back in 2 weeks or come back in a week time for your results. They didn't wait for me to come back. I got a phone call asking me to come in and collect my results. I needed to take it to my doctor. And they also confirmed that I knew something was wrong. When I went to her with the results, she told me, she said, Claudette, let's not panic. You know, sometimes it does walk like a duck and quack like a duck and it could be a goose. She said, but for us to rule out anything, we need to get a biopsy done because it's not looking too nice. So I said, okay, we did the biopsy. Again, when I do the biopsy, they call me again. They didn't wait for me to come in. So when they call me again and they tell me I need to come and pick up my biopsy and take it to my doctor, it is urgent. There and then I said, well, yes, this is it. So when I collect the biopsy and I took it to her, when she looked at me, she looked at the results. She asked me if I came alone. I said, yeah. She said, you want to call your husband? I said, I could call him, but you know, we could go ahead because I already know what she was going to see. So when she read it, she told me, she said, well, you know, your results came back positive for malignancy, meaning that I have breast cancer. It didn't really hit me then. So, you know, I was normal talking and she told me, she said, don't worry. She said, we have this. She saying, I'm saying we have this because she say I'm in this with you. I'm with you. She said we could beat this, but we need to act now because too many time passed by already just examining and doing ultrasound, and so we need to act on this right away. So by that time my husband came and she told me what she wanted us to do. So she introduced me to something called a tram flap. So she told me, you will have to do surgery. I know you're going to panic because you're young and you're going to study well, you will lose your breast. She said, so let us not focus on that. She said, I want you to go home. She gave me something to read. I want you to look up on what a tram flap is. So depending on what surgery that the doctor or for me, we would know where we're going from there. She said, but what I want you to do now, we have a lot of tests to check. For checking to make sure there is no spreading. So she said, I want you to go and do a CT scan. I want you to do an MRI. I did full blood work. I did a bone density test to make sure there was no spreading. She said, each letter she write urgent on it. She said, I want you to act on this now. She even make the phone call to the different health institution to make sure that I get an early appointment. When I was leaving from there, when my husband came, we talked, she explained everything to him. And I was normal, but when on my way to one of the clinic, I started crying. And if I cry for 5 minutes, I cry long. I wipe my eyes and I say, Lord Father Jesus, you see this, what my doctor now tell me, and you see this, what they give me to tote. I say, I can't do this. I say, I cannot deal with this, and I am not dealing with this. I say, you have to deal with this to me. I can't deal with this. And I wipe my eyes and went my merry road, dropping the letters, went in to get all my tests done. Now all of this, we reached 2012. By the time I did all the testing and everything, yeah, so we would have been at the end of June 2012 now, because by the time I discovered the lump, it was 2011. And by the time we get back all the results and everything, by the 19th of July 2012, I had surgery. But before that, when the cancer surgeon, my doctor asked the cancer surgeon, what surgery are offering Claudette? She said, I will be taking her whole breast. So she said, okay, well, Claudette wanted to do a particular surgery. So she tell me, well, I tell her I needed to have the both breasts removed. She tell me, no, she cannot remove my both breasts. The other breast, she will do a biopsy on it when I am in theater. I told her, no, I don't want a biopsy on that breast because time for biopsy gone. I said, I want you to remove the two. She said she cannot remove the two breasts because nothing is wrong with my left breast. And I guess under the medical law, it is against the law to remove the breast and nothing is wrong with it. I said, well, this is my breast and I want my both breasts removed. I don't want one breast. I prefer to have no breasts. And then I told her I was considering a surgery, which is to do the tram flap. So then I will need her to remove the two breasts. She told me, well, she have to get consent in order to do that. So I did speak to the CMO and we did get consent to remove it. I had the surgery done. But one of the reasons she didn't want to remove the both breasts is the length of time that I will have to stay in theater because my surgery took 9 hours. Because to remove and then they will have, because it's cancer, so they will have to make sure and sterilize and clear away everything. And then the other doctor will have to come in now in order to do the tram flap. So it took 9 hours. She was concerned about me developing clots in theater. But by the grace of God, everything went well. And I did the surgery. I started chemo like 3 months after, because after the surgery, and I had 6 cycles of chemo. My journey within doing my chemo, I'm not going to say it was boring like some people they say, but it was boring. But what I was expecting, it was totally the opposite, because I had no side effect from my chemo. I wasn't sick, I wasn't vomiting, I had no hair loss, anything like that. I was normal. I will do my chemo and I will go to work after. On the 4th day of after I have my chemo done, for 4 days, from the 4th day, I will go and get a Neutrogen injection. That's to produce new white blood cells to make sure that I always have good cells, because we know cancer kill out good and bad. And that injection, they tell me you get deep bone pain with it. I never get any pain with that injection. So doing the chemo, it was good. Getting the injection, it was good. Even surgery before, after, I had no pain. I had no complication, anything like that. About 6 months after, I started a medication called tamoxifen. It's like a follow-up to the chemo. I was on that medication for 7 years. Slight side effects, nothing to really complain about, little being irritable, when, night reach edgy, and, little problems to sleep, but nothing to really shout about. I was on tamoxifen for 7 years. After 7 years, my doctor told me she didn't see the need for me to be on the tamoxifen still, because follow-up after I did surgery every year, I will have my checkup done. I will have a CT scan. I will have an MRI, because I'm not allowed to do mammogram anymore on the breast. So I'll have a MRI. I will do a bone density test to check for, because normally one of the side effects with the tamoxifen, you could lose bone density. So I will do a bone density. I will do full blood work. I will do ultrasound. I did that for 8 years straight, but after 7 years, I came off of the tamoxifen. Here we are, 10 years after. I am in great health. I went to get my yearly checkup, but my doctor was telling me now that the law now is that they try to avoid doing all these tests and screening on cancer patients if it's really not necessary. You have to have a particular issue or a problem. If they find a lump, or you have an issue, you're sick and they can't figure out what it is, or something that they see in there, that they will send you to do screening, whether it's a CT or whatever. But normally they just want to go for doing normal examination, hands, breast examination, blood work, whatever that is necessary. But the only thing that I'm due to do right now is a colonoscopy, because I never had one done. So I was supposed to do that when I reached 50, but I am 53 now, so I need to get one done. And basically, that is it. I exercise a lot. If I tell you, I did not change my diet. My oncologist advised me. He said, Claudette, I will not tell you to don't eat this and don't eat that. He said, you eat what you're accustomed eating, but everything in moderation. Please don't overdo it. He said, along with your exercise, I eat healthy, drink healthy, but in between, I normally will drink what I like and eat what I like, but I take my exercise very serious. I exercise very often and almost every day. I don't play with that. So that is my journey there in a nutshell.
Wow, Claudette. Oh my. I don't know if saying thanks is enough, but thank you. Thank you again for sharing your story of hope. And yes, my word warrior still resonates, because I like particularly understanding that, this is not something that you take on by yourself and handing it over to your God, my
Yes.
God, showed such remarkable strength. As you said, you're probably for 5 minutes or less, but you fought and you
I
you're
put
happy.
it in his hands, and trust
Correct.
me, he dealt with it and he's still dealing with it.
Fantastic. What I love to hear. So we have some questions, Claudette. So what I'm going to do, I'm going to hand it over to Renee Barnett, and she is going to moderate those questions to you. If you need her to repeat the question, just let her know, just repeat it for me so that you can answer or act accordingly. Renee?
Thanks so much, Dawn. Good morning, everyone. Good morning, Claudette. Thank you so much for sharing that story. Very powerful story. Our first question is from Narendra. Is cancer hereditary?
Yes. So most cancers, not all, have a strong hereditary factor. Breast cancer in particular has two genes that you all would have heard of called BRCA1, BRCA2, and these genes can be turned on or off in our DNA. We all know the word DNA from COVID and all of these and our talks with the vaccines. So these genes can be turned on, but there are other breast cancer genes that can be turned on as well. And they're turned on and off based on hereditary, your family history, and also based on environmental factors, so extrinsic factors. Important to note, because you've heard of Angelina Jolie, Patti LaBelle, and look at Claudette. Claudette said cut off both her breasts. So if we had done genetic testing on Claudette, we would do it on Claudette to see what genes were there and what were turned on. And that helps Claudette's descendants and her siblings, because then their doctors can then decide to look for those genes in them, because to see if they are at risk to get the breast cancer, the same cancer Claudette got. That being said, that knowledge can make you, it allows you to make a decision, cut off or don't cut off. And that is a very personal decision. But to answer your question, yes, it is hereditary. There is a hereditary risk factor for almost all cancers.
Okay, excellent. Thank you so much. Before I swap over to Claudette's question, just one more question for you, Dr. LeBlanc. Is it possible that my family has no history of cancer and I can get breast cancer?
Oh, yes. Definitely. So the reason for that, and everybody's going to be like, oh God, everybody I hear have cancer. Oh God, cancer is like a flu now. You know, so there are so many reasons. You know, starting from extreme stress and having just a lot of stress for a prolonged period of time can alter, but that is altering, again, your genes being turned on or off. The other thing to look at is how we eat, what we eat. I love that Claudette ended with what she ate and doesn't eat, and because Claudette will tell you when we talk, and people try to say, I think we should juice, and I think we should eat this, and I say, no, life is very short. It's about moderation and balance. That being said, that doesn't mean you're going to put knowingly aspartame into your system, which is in Splenda and other dietary products, right? You're not going to put that in because it's a known carcinogen. You're not going to put in, you're not going to breathe in asbestos, which you know can cause cancer. You're not going to put a lot of MSG in your food, even though the Ajinomoto tastes nice and they have all new names for it. Know if it's there because it's a known carcinogen. So you have to know that, but you can have absolutely no family history of breast cancer or any cancer, and different factors have played a role in your developing cancer. So that is why screening, trying to be living a very healthy and moderately balanced life is so important, and being forearmed with education and being empowered and proactive about your health and wellness. Did I go off topic or did I answer your question?
No, you answered. Thank you. And I know I promised one more, but here's another one. What if I'm adopted and don't know my family's medical history? What do I use to guide me?
That's fine. If you're adopted, start with your annual checkups and do your appropriate screening that you have to do. So if you're a man or a woman, then every age there's appropriate screening to be done. Your annual checkups are important. And you see how Claudette had an intuition? We all have that, you know, and it's about listening to it, because you can't be fearful of if you follow that intuition, you know? So you have to listen to your body. If you feel something, and look, I will tell you, I had discharge from one breast, right? And I am a physician. I don't know what I mean. What is one breast leaking for and I not breastfeeding, right? So I go to doctors, I did all the tests, and this man tell me, well, you know, if I treat this, it will be like hitting a fly with a hammer. At which point I said, okay, great. But guess what? I went on from just like Claudia did. If you in your mind, you not calm, go and look for another opinion. Thank God it was not cancer. But guess what? His response was not appropriate. You understand? And my intuition was saying something is not right. They found what was wrong and it was fixed. It was not cancer. So my point is, do your checkups, listen to your body and know it. Cancer is not going to take you in a week. So don't panic. It ain't gonna take you in a week. But if you feel something and it's not feeling right, get that checkup, do the workup. Don't be frenzied and say, oh God, well in America they have a PET CT, so I'm going to pay $15,000 for a PET CT instead of doing your mammogram. Go step by step. Let the workup be done step by step. Cancer is not going to take you in 2 days, okay? And with that workup, it's done calmly. You get the diagnosis, and just like Claudette, go home. The doctor gives you the information to read. So when you make a decision and you say, I want both off, I want one off, I want a B, I want a C, I want a whatever, you have made an informed decision. And that is important. So if you're adopted, you don't know your family history, don't panic. Do your checkups, know your body, and start from there.
Great, thank you as always, Dr. LeBlanc. Over to you now, Claudette. This question is for you. Based on your experience and in hindsight, is there anything you would do differently or would advise persons?
No, I will not do anything differently. But what I will advise people like Dr. LeBlanc touch on is pay attention to your body. Our body speaks to us, but physically. Don't ignore it. Sometimes you have a feeling about something, pursue it. Go to the doctor might tell you, because let me tell you, no offense, Dr. LeBlanc, but sometimes it's not everything the doctor does know. Sometimes they themselves are guessing. Sometimes you go to the doctor and you have a pain. Sometimes they don't know what causing the pain and they will give you a medication to get rid of the pain. You don't only want to get rid of the pain, you want to know what is causing the pain sometimes, because sometimes you go back and the pain is there and you take the medication, it will go, it will come back, it will go, it will come back. And that's supposed to tell you it's time to have tests done to see what it is going on. Because like I tell somebody day before, not every time you get a pain requires a cup of garlic tea or orange peel tea. So we need to visit our doctor, although like I'm saying, sometimes they guess themselves, but that is what they are there for. We need to visit our doctor. So pay attention to your body and listen to our body. That is my advice that I will give.
I just want to add, so Claudette may have encountered some different doctors. So what happens is when we see a pain, we're supposed to ask certain questions. We're supposed to do a certain workup. And you're supposed to be able to, one, make the patient comfortable, because pain is a very negative response, while you research why that pain is existing. Right? So I understand Claudette's frustration, because I've seen it in some of my colleagues, unfortunately. But I do agree, and a doctor's like a shoe. If it don't fit, find a new one. You have to have that rapport with a doctor, and a doctor should know if a patient comes back twice with the same complaints, you need to do something. You have to look. Not only, you can't decide that nothing is wrong. You have to look deeper, and you have to give that patient peace of mind. Yeah, you have to do what is right. And so maybe take that, but don't be rude to your physicians, and just say, don't tell them you Google it, right? Just say, doc, could I please, just speak. And if you're disrespected in any way by a physician, you do need to find another physician, because we're supposed to be your guides, and we're supposed to be your support, and we're supposed to really show empathy towards you. Yeah.
All right, thanks for jumping in there, doctor. Back over to you, Claudette. Were you told the stage of your breast cancer once the results came in?
Yes, I did. I was stage 2.
All right, thank you. The next one is for you as well. Was all of your treatment done all privately or via the healthcare system in Trinidad?
Okay, at that time, was on my husband's medical plan. So yes, it was privately.
All right, thank you. And the next one, before we go back to Dr. LeBlanc, did you seek counseling throughout your journey? And if so, did it help?
I went to counseling once. Yes, it was offered, but I told them honestly, I really didn't need it. But I went to the first session. But one of the things though, in the counseling in the first session, they advised me to cut off all my hair. And I told them, no, I am not cutting off my hair. If it have to fall off, let me see it falling off. I didn't cut it off, and thank God I didn't cut it off, because it never fall off. But yes, I had counseling, but I just went to one session. Yes, it helped a bit. It set, you know, give me a clearer view of what I am going into. So yes, it did. It did help a bit.
Okay, great. Thanks so much for sharing. Dr. LeBlanc, this question is for you. My mom is a 7-year stage 4 colon cancer survivor. However, her mom, which is my grandmother, passed away earlier this year with the same type of cancer. Is there any advice you can give?
So your mom will be considered a metastatic colon cancer survivor. Stage 4 is metastatic cancer. She just has to follow her oncology team's advice, because the fact that she's been 7 years with stage 4 colon cancer, what they're doing is keeping it stable, right? So that's where she's at, where they'll keep the cancer stable. And it always depends on her health. And so she has to just follow her team and not give up, as long as she's comfortable. Because I want you to understand, when my grandmother, for example, was fighting, and Claudette will tell you that, you can make a choice to fight and you can get your chemo and radiation, but always know that there may come a time when your loved one will say, enough is enough. And if they say to you, enough is enough, they have to be given that right to have death with dignity and no suffering. Yeah, but that is their right as a patient, right? So your mom will fight as long as she's ready to fight. But she does have a battle, and her oncology team will keep her as stable as possible.
Thank you so much, Dr. LeBlanc, for sharing that. Another one, I think this one is for you as well. Do you have a better chance at surviving breast cancer if you remove the breast before chemo?
Oh, so it depends on the stage of the breast cancer. So Claudette's stage, for example, is a stage 2. So that means it did not go further than the lymph nodes of the breast. Yeah. So it depends on your staging. If you have a stage 3 cancer, and it depends on the size of the tumors as well and how your body is doing, the oncology team will discuss what should be done. Most times they will recommend maybe it depends on how bad it is. Like they could say do 1 chemo and then the surgery, or they could say let's do the surgery, do an intraoperative chemo. So that's a chemo while you're in surgery to mop up, and then continue the chemo and radiation therapy. So it's based, again, I want you to understand, it's individual. Yeah, the patient has to have that discussion with their oncology team, their family. You see how the counselor told Claudette to cut off her hair? They didn't give it to Claudette right. They should have said, there's a chance that you could lose your hair. Some women can't deal with that. So you can decide to sport a bald head, so you don't have to go through that trauma and say, oh my God, cancer is making me lose my hair, my breast, my sexuality, my femininity, and yada, yada, yada. They didn't give it to Claudette right. You understand? And Claudette is amazing how she bounced back from that because of her support system, right? And her mechanism. But every case, every breast cancer, every cancer case is individual. And that's why you need your family physician as your support. You need your oncology team. You need a nutritionist in some cases, a spiritual leader. You need your sister to help you, your brethren to help you. And most importantly, a group of survivors that are positive and not negative, because they will lift you up when you're down and you will lift them up when they're down. And that's so important, that you have to look at a very multifaceted, holistic pathway when you're going with that journey of this disease.
Wonderful. Thank you so much, Dr. LeBlanc. The questions are streaming in for you. Another one for you here from an anonymous person. I've had a lump in my breast from a child that I've never told my mother about. And I'm an adult now, but I'm afraid to go to a doctor because I'm afraid to know the outcome. How do I go about overcoming this fear?
Well, the first thing I tell you, Claudette, thing I like is if you had it since childhood, you ain't dead now. It's probably not cancer, because that cancer will not kill you in 2 weeks, but it will kill you in a couple of years. Okay, so that's number 1. Number 2, I hope that a session like this and illustrating to you survivorship in Claudette, illustrating to you that there is so much care and support for anyone diagnosed with cancer. But not only that, the fact that I told you not every lump is cancer will help you to go and get checked out. If you need support, take a friend, take a husband, take a partner, go and get that support, but speak to your doctor. That is how you overcome that fear. I mean, if you were near me, I could carry you, but I don't know where you be. So, I mean, you could tell me if you're in Trinidad and call me, and then I'll carry you personally to the Cancer Society and just let you understand, because you can't let your life be ruled by fear. You understand? Because then you're losing already. You have to look at it dead on. You have to be powerful and positive. You have to know that nothing that comes against you will prosper unless you let it, right? Any illness that you go through, from COVID, cancer, diabetes, pressure, selectively plumpness, cholesterol, and you name it. Any disease, you have to understand and let the disease cannot define who you are. And you can't be fearful. Do what is right. So my advice to you is be positive, get it checked. Reach out to someone you trust. Let them go with you. I'm almost certain, and I'm not a clairvoyant, but I'm almost certain that that lump you felt since childhood is not cancerous. But get it checked out, because you need to know if it's growing too big. That might be causing pain and you didn't know why it's causing pain. It might need to be taken out because of the size. So there are other things to look at. So get it checked out and know your body.
All right, thank you. Don't go anywhere yet. Just another one here for you. If my mother has breast cancer, but we don't have any other known family history of breast cancer, at what age should I start screening?
It depends on what age your mom was diagnosed to determine if you get screened earlier. But if not, you start between 35 to 40 years of age to get screened. But if your mom was diagnosed with a very aggressive cancer, let's say at age 40, then you should be screened by 35, if not before, because chances are you are at risk. So you need to be screened. But if not, then 35, 40 would be the age to start getting screened. But screening does not mean mammogram only. So you're supposed to be checking your breast every month, and you're supposed to get it checked every year. And if you don't do that, then start doing it. I know you ain't gonna check your breast every month, right? But come on now, every other month is not gonna kill you. You're in the shower, you're lying down on the bed, just do your self-breast examinations. Get it done. It's simple, it's not gonna take long. So just get it done.
Great. I think this next one is a good follow-on question before I go into a question for Claudette. Should we routinely get an ultrasound and mammogram, as the mammograms can sometimes be inconclusive?
Right. So the reason that you'll see some mammogram reports saying ultrasound advised is because we have dense breast tissue. Because of our ethnicity, because of our age, our breast tissue tends to be very dense. So the mammogram has a sensitivity and a specificity. So in order to be thorough, they recommend in extremely dense breast tissue that we add the ultrasound. And that is just added, it's like topping on the ice cream then, right? Or the cake, is to get more done, to be just a little more thorough. So it's not always necessary. It depends on the density of your breast tissue. And for example, y'all find out a lot about me today, boy. I have lumpy, dense breast tissue. So I always have to get a mammogram and an ultrasound. And also based on my previous medical history with the breast, they always have to do a mammogram and an ultrasound because I have lumps that they're monitoring. Yeah, y'all find out a lot about my history, boy. Full disclaimer.
You're part of the family, no, that's all right. Claudette, this next one is for you. Thank you so much, Dr. LeBlanc. Claudette, this person is saying, thank you for sharing, Claudette. I too felt a lump and went and got some tests done and was told that it was a cyst. It was painful and it ruptured. Should I still be worried about it?
Did she had it removed?
The person didn't specify. They just said it was painful and it was ruptured and it ruptured.
So she had a painful lump and it ruptured and it's hurting? Is that her question?
She's asking if she should still be worried about it.
It gone or it's still there?
Well, maybe if she's still on, she can send us another follow-on to that.
She need to.
So if you
Okay.
had a cyst and it was painful and it ruptured, then a follow-up ultrasound has to be done to see if the cyst has disappeared. So why is that important? You can have cysts in the breast that will disappear. They will rupture and go. Pain in the breast is different. So you can have cyclical pain, which is pain every time you ovulate, and PMS pain in your breast. That is not the pain we're worried about. The pain we're worried about is the constant pain in the breast or the nipple or the nipple. That is the sign and symptom that will give us a heads up that something is wrong. So your cysts may respond to your hormones, right? So based on what's happening, your cysts may rupture or they may go down and pop up again. And that means you may have what we call fibrocystic breast disease, and therefore you have to be followed up by a breast ultrasound in a certain amount of time, usually 3 to 6 months based on what you're presenting with. I hope that helps.
Yes, I'm hoping it helps too.
Doc,
as well.
that was a
Thank you.
question for you, not for me.
Well, you're Dr. Claudette.
All right, so as you're here, Dr. LeBlanc, the next question, I think this one is for you too. So I was told that breastfeeding prevents breast cancer. Is this true? If it is true, how long does this immunity last?
Oh God, don't kill me. All right, so breastfeeding is good for many reasons. Breastfeeding makes you feel nice. It helps you lose some weight. It's a birth control postnatal for a couple of months once you breastfeed exclusively. It makes you feel nice and close with your child. And breastfeeding also has been noted to decrease, you hear that word? Decrease the risk of breast cancer. It is not a shot of immunity at all, right? It decreases your risk of breast cancer. And the reason for that is it's about the hormonal influence on the breast, and it's about letting the milk out and letting so let me put it to you in a traditional Chinese medicine kind of way. It's letting the energetic flow happen with no stagnation. So less chance of a blocked papillary duct, less chance of blockage of the milk ducts themselves. So decreasing the risk of breast cancer. But it's not a sure, if I breastfeed, I'm not going to get breast cancer. You understand? It just decreases the risk.
Alrighty, thank you so much. I think this next question is a follow-on from the person who asked about their mom and grandmom. So the person is saying, thank you. This is related to the colon cancer in my mom and grandmom. I also meant to ask if there's any advice or adherences you can give me since cancer is hereditary.
Yeah, do your colonoscopies, because you definitely have a strong family history of colon cancer. So you're somebody that will be recommended to do colonoscopies often. And so you have to be in close contact with your family physician and the gastroenterologist who will do the colonoscopy. And also look at your fiber in your diet, your exercise. Don't be afraid to look back and see what comes out in the toilet when you go. Be very clear about that and speak to your physicians and be very cognizant and aware of what is in your history. You understand? Because it's not saying you're going to get it, but at least if you keep checking and you do what you have to do in terms of how you eat, your exercise, and et cetera, and being very much aware of your possible risk factors, that will decrease you having more than a stage 1 then. You understand? Because it will be detected earlier. Yeah? But don't be fearful and don't think that that's your lot in life. Don't live in fear.
All right, excellent. And the last one, can you explain the mammogram procedure?
Yes, I can. So on the day of your mammogram, you're told not to wear any cream, powders, perfumes, or lotions or oils, right? You go in to whichever facility, you do all the admin work, you fill out your forms, then the mammographer or the tech will call you. You will have to take off all your jewelry, every single piece, your chain, your earrings, your watch, your rings, everything comes off. They give you a nice, cute gown, I hope. If you go to the cancer site, you get a nice, cute gown. And then you go into the mammogram room. In the mammogram room, the mammographer or tech will position you. There are 3 views that we look at. The first view, we go down like this. So the 2 plates will come down and gently squeeze. You hear the word gently because it's a very different machine now in terms of least amount of compression pain. Then they do a view like that, and then they do an oblique or diagonal view on each breast. The mammographer will position you. You will never be in the position for longer than a minute at most, right? It's just a little, and you're done. They release your breast, right? Yes, you have to go in some funny positions, but it's not impossible, yeah? And this whole procedure will last roughly 15 minutes once you cooperate and you're positioned correctly, and it saves your life.
Alrighty, excellent. Thank you so much, Dr. LeBlanc. And Claudette, the last question is for you before we hand back over to Dawn. How has breast cancer changed your outlook on life?
It changed my outlook on life. One of the main things is that I have learned to leave things alone that I have no control over. That's one of it. And what I have control over, to deal with it. I stop fussing and, making an issue with sometimes, things we like to interfere with things and fuss with things that we know we have no control over. I have learned to leave that alone, live my life positive. I do me. I do me a lot. I do me. When it's my time to exercise, I ask my family to please do not disturb me and bother me. If it's at 1 hour, 2 hours, give me that time. That is my time. That is me time. Don't call me. If somebody's sick, I am not a doctor. If somebody died, don't call me unless it's an emergency. Leave me. Give me my time, my space. Basically, that's it.
Wow, Claudette, thank you. I want to thank first our moderator, Renee, for ensuring that those questions were posted to you. But I really want to thank you for sharing your story today. It was very, very empowering. And I hope that your message will reach someone in our session today. And even if not today, when we post on our YouTube channel and someone watches and hears you, I hope that they're empowered to do what is right for them and to make the changes without fear. To Dr. LeBlanc, I want to thank you for being here today and for giving of yourself, as well as the information from a medical standpoint to help bolster what Claudette was able to bring out in her share. So thank you once again for the empowerment, ensuring that we understand how important it is that we get out there, we do what is right as females, even get our men to do what they're supposed to do. This was indeed a powerful session, and I want to thank you, Claudette, and I want to thank you, Dr. LeBlanc. So, as we wrap up another Level Up Wednesday, I want you to remember to look out, our audience, as you look out, remember that we have our November programs coming up. And before I even say that, I want to thank you for being here in this space that was created and sharing with all of those questions that were all important. So I really want to say that before I say we're wrapping up. If there are any other questions that you want to send to us so that we can have Dr. LeBlanc or even Claudette respond to, feel free to email us, emily.enrollment.com, or for those of you within the organization, you can send them to myself, Dawn Lane, Renee Barnett. We'll be happy to pass them on and have them answered for you. So please, as we end the session, November is upon us. Look out for the Everlife programs. We have for November programs such as Excel for Beginners. This is a fantastic program. The classes have a waiting list, but please jump on. We have managing project schedules and resources. We have data analytics, a new program, new material. And of course, we have our MLI signature programs, Listen Like a Leader, EI, Coaching for Performance, and so much more. Just visit us on our website, www.masseylearning.com. masseylearninginstitute.com for more information. And until next time, continue to level up. Have a good day and bye-bye.